Please share the link to yourself. Hello, amazing ladies. You're welcome. Good evening, everybody. How are we? How's our day? Today is finally the day. Let's talk women's health. Okay, so I want everyone to join in before our guest speaker arrives. Please let's kindly join in. Hi, good evening, everyone. You're welcome. Okay, so hi, Glory. You're welcome. Good evening. How was your day? How was your day? So let's just give a few seconds for people to join in. Please, when you join in, kindly introduce yourself, tell us your name and where you're viewing from just before we invite our guest speaker. Okay. Hello, Rita. You're welcome. You're welcome. So at this point, I'll be adding our guest speaker. Okay, when she comes, I want you all to welcome her very well in the comment section. Make her feel happy, make her feel loved. Okay. Oh, God's glory is joining from Abuja. Oh, thank you so much for joining us. Thank you. Please share the link on your status. Want as much people as possible to join in. So can you share the link to your status so that more people can see and they can join in? Okay, so I'll be adding our guest speaker in right now. Okay, I'll be adding Dr. Lizzie right now. Okay, so if you're joining in, kindly tell us your name and where you're viewing from. Please also share the link on your status. Our guest speaker is on the way. Like, I've sent the link to her. She's about to join in. Okay, this is going to be an amazing session. We had a lot of questions, very, very interesting questions. So, if you still have questions, because I know some of you did not send in questions, but you might still have questions. Okay, so just when she's here and as the session has begun, you now type in your questions in the comment section. Okay, everybody can see it. I can see it, and she will be able to see it. So sorry for the little glitch. We're just trying to get her to connect. So we'll start immediately. Oh, our guest speaker is around. Good evening, Dr. Shekolo Elizabeth. We are so excited to have you on board. Thank you so much for being here. Thank you so, so much.
Good evening, everyone. Good evening, Ma. Thank you so much for having me. I hope I can be heard loud and clear.
Yes, it's very loud and very clear. I'm sure they can hear you
All right,
too.
that's great.
Okay, okay,
Okay,
okay. So, starting immediately. So, I think I would read the questions we have. Then, is that fine by you?
that's okay.
Okay. Okay. So, I'll read the questions and then you can answer. Okay. So, starting with the first question. If a lady or if a single lady who hasn't gotten pregnant uses contraceptive of 3 or for 3 years, a single lady who has not gotten pregnant uses contraceptive and is now married and ready to conceive, those contraceptive affect her tendency of getting pregnant? That's the first question. Please, did you get my question, ma?
Yes, I've gotten the question.
Okay.
Okay, so if a lady uses contraceptive for 3 years and then now she has stopped the contraceptive and she wants to get pregnant, right? Will it have
Yes,
the
yes,
tendency of affecting her fertility?
yes. That's the
Okay,
question.
all right. Okay, so now contraceptive actually do not they do not affect long time fertility. They do not cause permanent infertility. Contraceptive, it depends on the type of one she uses, but most contraceptive, once you use them and you stop them, you should be able to get pregnant, some immediately, For example, like the copper IUD, the non-hormonal one, immediately after you stop using it, within few days you can get pregnant. Others like the contraceptive pills, there may be delay in return of fertility, maybe for days to weeks. And some, the ones that actually do take a longer time, like up to a year or even up to 18 months, is like the injectable, like Depo Provera. That one, because you know this what these contraceptive do is like they affect somebody's hormone, like they play around with, do I say play, like okay, they act on the hormones. So some of them actually have the tendency of delaying someone's fertility, the return of fertility, but they do not affect fertility permanently. The highest is the one with the injectable that can take up to 18 months um after stopping, before return of fertility, but most of them within few days to weeks, a month, fertility returns, except if the person has a pre-existing infertility problem even before using the contraceptive. But contraceptive do not affect long-term fertility. I hope that is clear enough. Thank
Yes,
you.
that's clear. I just hope it's clear to the audience. However, if they have any question, they will drop it in the comment section. Thank you so much, Dr. Lizzie. Thank you so much. So we'll be moving
You're
to
welcome.
the question, which says, if hymen can break during menstruation, does it reduce the pain during the first time intercourse?
Okay. Well, hymen. Okay, yes,
Hymen is
hymen can break as a result of dry menstruation, which could be probably from the use of tampon, even from sporting, from cycling, and other activities. It can actually break because it's just a thin membrane that closes the entrance. But then I want the person to understand that hymen is just a part. You get, like there are so many things that contribute to painful intercourse, for like during the first painful intercourse, of which hymen is just only a part of it. Some, even in the first intercourse, the hymen doesn't even get to break the first one. Some have very stretchy hymen that it doesn't get to break. But then hymen is just a part of it that could cause pain. And it breaking does not mean, or it's being torn does not mean that it will reduce pain during the first time the person is having sexual intercourse. There are some factors that could contribute to the pain. Being the first time, there could be that fear and anxiety. And then when there is fear and anxiety, the pelvic muscles won't get to relax as they should relax. So that can cause pain to the person. And sometimes when there is no enough lubrication too, maybe because there was no enough foreplay before the penetration, vaginal dryness too can cause pain. So hymen is just a part, actually. And it's being torn does not mean the person will not have pain. And it's being there does not mean the person will have pain. For some people, for the first time, it's extremely painful, but for some people, it's not painful at all. Thank you. Hello, Dr. Precious, are you there? Um, I think she's having problem with her network. Okay.
I'm back on. There was there was a slight network glitch, but I'm back
Yeah, I
on. Please, can
noticed
you hear
that.
me now, Doctor?
Yes.
Thank you so much. So sorry about that. Okay, you finished answering the question, right?
Yeah.
Okay. Um, please, I want to know if you all got the question. I mean, the answers. Someone is saying, I never knew the hymen was elastic. Okay. So now you know. And the hymen contains blood, right? That when it's broken, it's being shed. Blood is being shed. So it can break in different ways, just like doctor has spoken. But my question
Yeah,
is,
and also
without,
sorry, and also
please go on, ma.
there's this, yeah, also there's this misconception that maybe during the first intercourse there will have to be that bleeding. If there's no bleeding, it means the person is not the hymen is not there or something like that. It's not actually always true. Sometimes the hymen can like tear with minimal bleeding that you may not get to see it stained on the bed sheet and and all of that. Thank you.
Okay. Thank you so much, doctor. So moving on to the next question.
Okay, Dr.
Okay,
Precious, you are muted. Okay.
the next question says, my cycle used to be for 3 days. Now it's for 5 days. Should I be worried?
Okay. Cycle. I guess she's talking about the menstrual flow, like the
Menstrual
days,
cycle,
period
yes.
days, not the cycle, right? Because
Hmm.
talking about cycle, we are talking about like every monthly,
Everything.
not the flow. But if she says cycle, it means
Yeah.
I think she's talking about the flow, right? Period flow.
Menstruation, yes. Yes, yes.
Okay. So it's usually 3 days and now it's 5 days.
Yes.
Okay.
Yeah.
That is actually not a problem because for the normal period flow is 2 to 7 days. So if hers used to
Hmm.
be 3 days and now it's 5 days, is actually not a problem, except if there are other symptoms she's experiencing that have not been there before. Maybe the bleeding is now heavier than it used to be, or other symptoms. But if not, it's still within the normal period flow day, so it's not actually a problem. But if there are other symptoms, then I will actually advise that she see a medical practitioner for that. Thank you.
Okay. What are other symptoms that could accompany, being worried? Maybe she didn't state clearly enough, but can you just name some of the symptoms so that she'll be aware, so that if she sees any of these symptoms, she'll be able to, go see a doctor?
Okay, probably now she don't usually have a heavy flu, and now she's having like excessive bleeding, heavy flu, like sucking her pad maybe let's say every 3 hours, which is not like that before, or maybe painful period, or she's beginning to experience clots, or maybe from because of the heavy flow she's beginning to experience maybe dizziness, she's getting unnecessarily tired. That shows she's losing so much blood, and there's a kind of sign of anemia. So those are things that should actually make her she should see a physician.
Right. All right. Thank you so much. Thank you so much, ma. So we're moving on to the next question. And this question says, I occasionally see these white sticky droplets on my panties. Is it normal? The smell is not offensive, and I'm not married, neither am I active. Maybe she's talking about whitish discharge on her panties. So she said the smell is not offensive, but is it normal? I think it is. She's not married, neither is she active.
Okay, so vaginal discharge um It's a natural part of the female reproductive system. Like every female has discharge. And then the consistency, the amount, and also the color of the discharge changes at every point within her menstrual cycle. It depends on which point. Sometimes it can be sticky, sometimes it can be clear white, just like an egg, raw egg white. Sometimes it can be like a paste. So it depends on the phase at which the person is in the menstrual cycle. And then also the color can be clear or milky, which is normal. But then it becomes abnormal when there's an offensive smell. But in her case, there's no offensive smell. And other symptoms like vaginal itching in the vulvar area, or swelling or rashes around the vulvar area, or she's having pain in her pelvic lower abdomen and all of that. But if there are actually no other symptoms, just the discharge she's seeing, it's actually normal, except if there are other symptoms.
All right. All right. Thank you so much. When I saw this question, I know one of the things that came to my mind was also during ovulation. I know during ovulation there should be this whitish discharge that should be stretchy. Am I right? Eh.
Yeah,
So
during
it just
ovulation,
also
the discharge
and
becomes clear, just like an egg white and stretchy.
yes, yes, okay. Okay. So and also, she just feels like okay, because she's not married and she's not active, so she's feeling like she should not be having the discharge. But I guess all of these discharges are normal.
Yeah,
So
every woman
whether you are
produces
married or not,
discharge.
yeah.
And if your
Okay.
vagina is not producing discharge, it means there is problem.
Abby.
Yeah.
Okay. Yeah, thank you so much. Thank you so much, doctor. Okay, moving to the next question. Says, can women with PCOS have regular menstrual cycles, or is irregular menstruation always present? And what practical steps can women take to maintain good reproductive health and protect themselves from sexually transmitted infections?
Okay, I think the question, there are so many questions lump, right? One is, can women with PCOS have regular menstrual cycle, right?
Yes, that or is irregular menstruation always present? So that's the first one. Maybe you should answer that first. Then I ask the second one.
Okay, all right. So PCOS, okay, now there has been a change in the name. It's no
Mm,
longer
mm,
PCOS. Polycystic ovarian syndrome is now polyendocrine metabolic syndrome.
mm. So
It's
that's
now polyendocrine.
PMOS.
Yes. So like for short, PMOS. That's what I call it for short.
Mm,
So
yeah.
yeah, so women with PMOS, they can actually have a regular menstrual cycle. They can have it, although irregular or absent period are one of the common features of the condition. But then not every woman with that condition do have that irregular menstruation. Now, for
Okay.
yes, having a regular monthly period do not like it's if you have regular menstrual period, it doesn't rule out completely rule out because I don't know if it's clear. Now for this condition to like a kind of diagnosed, there are some things, there are some features we actually usually put together. If one has those features, then we can see that this woman has PMOS. For one of which is if we do an ultrasound scan and the ovaries is polycystic, it has cysts, multiple cysts in the ovaries. That's one of it. And then second is when there is irregular ovulation. When there is
Mm,
irregular ovulation, and then also when there's a test in which there are high levels of hormones, like if there is hormonal imbalance, like hormones, high level of hormones like androgens, like testosterone. So a woman will have to have those three features combine, at least two of those three features before we say she has polycystic ovarian syndrome. So you can still be ovulating, so you can still be menstruating every month, and then but you still have PCOS.
Okay.
I don't really know if it's clear enough.
Yes, I get it. I hope the audience gets it also. Please, if you're not clear enough, can you just let us know in the comment section? Okay, so after asking that, the next question she asked is, what practical steps can a woman take to maintain good reproductive health and also protect themselves from sexually transmitted infections?
Okay, to maintain good reproductive health, um, is to maintain healthy daily habits. That's one of the ways or the basic ways to maintain good reproductive to maintain good reproductive health, and not just daily habits, also practicing safe sexual practice. Now, for those, the best is abstinence, and then for
Mm,
those who can't abstain, you can actually stick to. It's better you stick to one sexual partner, or you can use things like condom to protect yourself, or you can you can also try to do regular health checkup to screen for sexually transmitted infections. That's another way you can do that. You can also have a routine cervical cancer screening for
mm,
those who are sexually active, and also to maintain a good health, sexual health, you also get vaccinated, specifically with HPV vaccine. I don't know, some of us I know must have heard of the HPV vaccination that was have been it has been for years. I think for
yeah.
about 5 years now, that is usually given to girls from 9 years to 14 years to protect them against cervical cancer, HPV infection. Those ones is free for 9 to 14 years, and
Mm,
because it's believed that they've not been exposed. But even if you have been sexually active, you've been exposed, you can still take the vaccine. Is those 3 doses, yeah, 3 doses. At least that will prevent you from the strands that you've not gotten infected with if you've been exposed before. And also you can maintain a healthy lifestyle by eating balanced diet, exercising regularly, and having enough sleep. And also practice good menstrual hygiene. Change your sanitary pad as often as possible, often as possible, depending on how heavy your flow is. But at least, as bad as it bad, let me use it. You should change twice in a day, even if you are not having heavy menstrual flow. And then for those that are having heavy menstrual flow, you can change it as often as possible, because leaving that blood there, like it's not only even irritates you or irritates the vaginal area, it can harbor microorganisms. So you should change it as often as possible. And then also wash your genital area with water. I know there are a lot of people feel, oh, water may not clean the area very well, but honestly, all you need, because the vagina has a way of protecting, cleaning itself naturally. That discharge that comes out is part of the discharge. Is not just mucus. It contains a lot of things, including waste products that are being and this thing, tissues, lining, old dead cells that are being shed up through the discharge. So water alone is enough. You don't have to use chemicals. You don't have to use all those what do you call them, intimate wash and all of that. Yes, it's good. Those intimate wash can give you like, oh, that freshness, feeling fresh and all of that. But some of them, they can change the pH of your vagina, even exposing you to infection like yeast infection, bacterial vaginosis, and others. So you can practice good hygiene by washing your vagina with water. Sorry, the vulva area with water, or maybe mouth soap if you really want to use soap. So I don't know if I've answered the question. Hello, can I be heard? Dr. Precious, are you there?
Okay. Thank you so much, Dr. Lizzie. Thank you so much. We speak peace to
You're
this
welcome.
network in Jesus' name. Yeah,
Amen.
yeah. Please, if you can hear me. All right. Move to the next question quickly. And it says, sorry. Okay. So this next question says, my question would be on fibroid for a 25 years old young lady that has been diagnosed with the condition fibroid. What would be your advice in regards to lifestyle and general well-being?
Okay. Lifestyle. Okay, so for lifestyle, for the person that has been diagnosed with fibroids, basically the lifestyle is just lifestyle modification, um getting just eating balanced diet. This balanced diet, we keep mentioning it today because it's very important. Having enough sleep, resting, and also going for a regular follow up. Like you don't have to wait until, like, when you're diagnosed, you just don't, like, a kind of wait maybe until you have symptoms or all of that. But then first, to even start with, now I want to reassure the person that has been diagnosed, or anybody that has ever been diagnosed with fibroids, that fibroids is something that is very common. A lot of women are carrying it around. Some don't even know. Some you won't even know. It's not, so it's something that is very common, and it's not a cancerous growth. So there is not nothing to be scared about it. So for lifestyle modification, I've already said you eat balanced diet, exercise regularly, avoid sugary diets or highly processed food, and also, if you're having fibroids can come with symptoms like heavy menstrual bleeding. If you are having heavy menstrual bleeding and probably you feel dizzy, you feel weak easily or tired and all of that, that shows anemia. So you can eat um food that contains iron, that are rich in iron, like green leafy vegetables like spinach, ugu. They contain iron. But if, yeah, it's actually the weakness is severe, um you can add iron supplements. For that, you have to see a physician to know which exactly you should use. You should also manage your stress level as much as you can. Do not expose yourself to too much stress, and also go for regular checkup to monitor the size of the fibroid. It can increase in size over time, so it's good if you can be going back for, like, regular this monitoring scan to monitor if it's growing, and then if it's not growing. And also, do not rely on, like, herbal medication. I've had a lot of times that some people will say, I was given this medication, and it dissolved the fibroids, or it shrinked the fibroids and all of that. Honestly, there's no any scientific backing that there's any medication that dissolve a fibroid. We've not seen yet. Maybe somebody will come up with it, but we have not seen yet. Yeah, there are some medications that can reduce the size, but to dissolve fibroids, no. And some of those herbal medication, they can affect your kidney, they can affect your liver. You are trying to manage fibroids, and then you now end up with something that is more complicated. So please do not rely on anything that is unproven, all those herbal remedies. It's better to go the right way than to follow shortcuts and then end up having more complications. Um, thank you. I hope I've answered the question. All right.
Absolutely. Absolutely. Thank you so much, Ma. Thank you so much, Dr. Lizzie. God bless you greatly. Okay, the next question we have
Mhm.
is the person is asking, why does the vagina have a fishy smell despite having washing it thoroughly? Like she has washed and washed and washed, but yet it still has a fishy smell. So she wants to know why.
Okay. The vagina shouldn't have a fishy smell. Not that the vagina is completely like smellless. Yeah, it has its own natural odor, but fishy smells indicates that there's an ongoing infection, bacterial vaginosis. So washing, no matter how much the person washes it, it's not really going to clear that smell. The person will have to look for the root cause of the problem, which is bacterial vaginosis, and treat it for that smell to go completely. So washing will not solve the problem. What will solve the problem is treating that bacterial vaginosis. And the earlier actually the better, because the more the person delays treatment, the worse it becomes.
Hmm. Hmm. Okay. Okay. Thank you. So we have one question here. Said, please can you go over infections again? And what can one do if one has recurring infections and sometimes discharge?
Okay, I didn't actually get you clearly.
Okay, the person wants you to go over infections again. And what can one do if one has recurring infections and sometimes discharge?
Okay, okay, let me in a brief, because infections. I believe she's talking about vaginal infections, right? Yeah. So
Yes, yes.
it's actually broad, but let me make it brief. Now, for vaginal infections, they can be both sexually transmitted and non-sexually transmitted infections, and all of them, most of them have similar things in common. For example, vaginal discharge is something that is very common with almost all of them. In almost all of them, there is vaginal discharge, but then there are colors that differentiate. Okay, when you see this color, you know that this is actually the type of infection you're having, and all of that. But the sexually transmitted one is the yeast infection and bacterial vaginosis. Yeast infection is very, very, very common. And that one, almost every woman in her life can experience it maybe once in her lifetime, or even more. It's something that is very common, and that one um is not in any way linked to sexual activities. It's even daily habits can expose one to yeast infection, like taking antibiotics for a long time unnecessarily. Those antibiotics can destroy the good bacteria that are in the vagina um that protects the vagina, and then it allow yeast infection to grow, causing yeast to overgrow, causing infection. Because normally there are a little amount of this thing, bacteria, good bacteria, lactobacillus, that's what we call them, in the vagina. But then when they are destroyed, it gives room for yeast to grow. Taking too much sugary things can is a risk factor. Diabetes is a risk factor, and even using all these intimate feminine wash that, I said some of them can disrupt the normal balance in the vagina. So those ones can expose someone to all this infection. And even washing from the back to the front, like all microorganisms from the anus can be swept into the vagina as you are washing from back, and that is why it's always advisable to wash from the front to the back. Bacterial vaginosis too is a non-sexually transmitted disease, but it's related to sexual um activity. Now,
Mm,
all these things, they have different symptoms. Like for yeast infection, there's this classic thick white discharge. The discharge is usually thick and is white and is usually accompanied by intense vaginal itching. That's characteristics of a yeast infection. The person can have rashes around the vulvar area, pain, burning sensation during urination, and all of that. So for bacterial vaginosis, that too is when the pH of the vagina has been disrupted, either by the use of all those, either by sexual activity, either by the use of all those intimate wash, douching, and all of that. It can disrupt the normal pH, and then bad bacteria will begin to grow and cause all those problems. The symptoms usually this bad odor, fishy odor. That's characteristics of vaginal infection. I'm sorry, bacterial vaginosis. And then the fishy odor intensify. It gets worse in after sexual intercourse. And then it also has discharge. The discharge is usually thin, it's not thick and gray in color. There can be pain too during urination and all of that. So those are the non-sexual um transmitted infection, vaginal infection. And then for the sexual ones, there are things like chlamydia, gonorrhea, and trichomoniasis. Those ones, they are mainly sexually transmitted. Then they also have different colors of vaginal infection. Sorry, abnormal vaginal discharge. They can be yellowish in color. They can be greenish. They can have symptoms like itching, bleeding during menstrual cycle, maybe bleeding, have some bleeding after intercourse, pain in the lower abdomen, and all of that. So those are the group of sexually. And sometimes one can even have symptoms without infection, maybe from irritants, like using perfume. You know, some people use perfume in their private area because they want to smell nice.
Wow.
So,
Really?
yeah.
Really?
Yeah, some
Hmm.
people use this perfume there. Some people use this, all manner of things in there. So sometimes it's not
Hmm.
really that it's coming from an effective agent, but because of those things they are using, it can irritate the area and cause symptoms. So
Hmm.
in brief, actually, it's broad, but I don't know if the person has been able to get something from this summary.
Yes. Yes. I hope so. I hope so too. I hope so. Okay. Um. We're moving to another questions. Another question, rather. It says, okay, I think this is like similar to what you've answered before. What does
Okay.
one do when one is diagnosed with fibroids? The person has started experiencing the symptoms but does not want to go for surgery because the person is not yet married and believes it is better to be married or about to be married before getting any surgery done.
Okay. You know, now the management actually depends on the size of the fibroids, the location of the fibroids, and if the fibroid is causing symptoms or not. Now we know the ultimate treatment for fibroids is surgery, but there is not all fibroids that we do surgery for, except if some fibroids can be there and they are not troublesome. You won't even know they are there. Some women carry fibroids. Maybe they even went for maybe a test for something, a scan for something, and they will discover it. But those ones that are there, they are not causing problem. Usually, we just leave them alone. We just keep like monitoring to see over time, doing scan to see if it's growing or not. So if the fibroids is not causing problem for the person, actually it's not an indication to remove it. But then sometimes some can be very small and can be causing trouble, can be troublesome. So there are some indications that we used to know if the person actually need a surgery or the person doesn't need a surgery. Like if the person is having excessive, some fibroid can cause excessive menstrual bleeding, some can cause excessive pain, some can cause recurrent miscarriage, can cause even like infertility.
Mm.
So in those cases, the fibroids should be removed. But then if the fibroid is not causing problem, there's no need for it to be removed actually.
Okay. 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 Thank you so much, Dr. Lizzie, for that. Quickly, we're moving to the next
Welcome.
question. This question says, um, okay, this is what the person wrote. My question is around PCOS. We find many of our young ladies with this of recent. Some will say because she's a virgin that way, and others will say untreated infection. So I want to know, Ma, does PCOS actually have a cause? And how can we help prevent it in the coming generation?
Okay. Um the I sorry, I heard the person because the person is a virgin. Did I get that right?
Yes, that some will say is because you're still a virgin, and some will say it's because of untreated infection. I mean, those some people say those are the causes of PCOS, but she wants to know the actual cause and how to prevent it in the coming generation. So, does virginity have anything
Okay.
to do with PCOS and untreated infection? Does it cause PCOS?
Okay. First of all, let me clear the misconception. PCOS is not caused by being a virgin, neither is it caused by untreated vaginal or pelvic infections. Actually, that's a misconception. And the exact cause of PCOS is not known, like medically. The exact cause is not known, but there are several factors that contribute to that. And one of it is genetics. Now, if a person has a family history of PCOS, maybe the mother or the sister, the person has a high distant chance that the person is going to have PCOS. And then also insulin resistance is part of the um, factors that contribute to it. Hormonal imbalance is part of it. Though we don't know exactly what causes it, but these are the things that contribute to one having PCOS. And unfortunately, there's no like guaranteed way that prevents one from having PCOS. I said that genetics play a role in it. I know when something has genetics in it, it's not really it's not really preventable. There's no guaranteed way of preventing it, but then the person can reduce risks by maintaining a healthy lifestyle, managing stress, exercising, and all of that. That can help to reduce the risk of adolescents coming with PCOS in the future. I don't know if it is clear because like the
Mm,
insulin resistance now, what what it does is that now normally when somebody insulin helps glucose to go into the cell, but then if one is having insulin resistance, when for example someone takes some carbohydrates, the glucose won't be able to go into the cell, so the pancreas that produces insulin we feel, oh, there's need for more insulin because insulin is what cause the muscles to like to take up glucose, so more insulin will be produced. And then now when there's high level of insulin, this insulin will stimulate the ovaries to produce hormones, androgens, that's testosterone, which is basically male hormone. And then it causes hormonal imbalance, and then it comes with all those symptoms of PCOS that we see. So that's why the lifestyle modification is very important. When one is maintaining a healthy diet, there will be decreased resistance in that insulin, and also there will be decreased level of insulin. And when the insulin is low, of course, there won't be that stimulation of producing more androgens that affects the hormones and all those ovulation that we see in people with PCOS. And exercise to help to lower the level of insulin. It also help to lower insulin resistance and all of that. That's why the lifestyle modification is very important. It can help to reduce the risk of one getting the condition. I don't know if it is clear.
Yes, it's clear. Thank you so much. So, there's a question related to that. Let me just quickly say, doctors will always tell their patients with PCOS to wait until they are ready for marriage and childbearing before coming back to get the drug. My question now is that, does one have to wait till after marriage, or are there other ways or medication that can help to manage the PCOS that will allow the person to menstruate and ovulate normally?
Okay, so I don't know exactly which medication the person is talking about, but probably I from the word person is saying to, I believe is those ovulation induction medication. I think
Mm,
because now in managing PCOS, it's not just we use different there are different symptoms and which require different medication or management option. But let me believe, I don't know if the person can clarify the question, but I think the person, because the person said the drug, so
yeah.
and then the person is relating the drug to conception. So I think it's the ovulation induction drug that the person is talking about. Yeah, if the person is actually not ready to conceive, there is no need of using
Mm,
the ovulation induction drug, and that's why doctors will tell you, okay, you should wait until you are ready to conceive. But then that does not mean other symptoms cannot be managed, like all those heavy menstrual period and the acne and other things. They are actually being managed. It's just the ovulation induction drug that we usually advise people to wait until they are ready to conceive, then we give them. But other medications are being given to manage other symptoms.
mm, okay. Okay. So, if it's the ovulation induction, the person should wait till when they're ready to conceive before taking it.
Yeah.
Okay. Okay. All right. So, I think we're left with two more questions. Recently, I noticed that I have white cottage cheese like I noticed that I have white cottage cheese like discharge, which is usually odorless. I don't itch or burn as well, and I observe a very good personal hygiene. This doesn't happen always, sometimes towards the duration of my period, or I notice it after being intimate on my partner's scrotum. I've used inserts and brand tests. I don't have infection. What could be the cause of this?
Can you go over the question again, please?
Okay. It says, recently I've noticed I have white cottage cheese like discharge, which is usually odorless. I don't itch or burn as well, and I observe a very good personal hygiene. This doesn't happen always, sometimes towards the duration of my period, or I notice it after being intimate on my partner's scrotum. I've used inserts and ran tests. I don't have infection. What could be the cause of this?
Okay. Um, Towards the end of the period, that's before her next menstrual period, right? Towards the end of her
That she
cycle,
noticed
I think that's
during,
what she's trying to say.
yes, towards the duration of her period. Yes, I'm sure that's what she's trying to say.
Okay, so if it's actually towards the end of the cycle, that's before the beginning of the next cycle, if actually that's what
Mm,
it's around that period, yeah, the vaginal discharge around that period is usually a kind of thick, but the way she described it as cottage cheese, like specifically,
yes.
that's yeah, like like specifically that is, if actually is thick, it can be like make a kind of thick like paste, a paste like pasty or there it's normal. Especially she said there is no no itching,
Although
no
there's no headache
burning
or
sensation, no odor, and all of that.
mm,
It could be normal, and then it could still be yeast
mm,
infection, because sometimes at the early phase it may not come with those itching, those burning, and all of that. And then yeast, discharge from yeast is usually not does not have offensive odor. It doesn't. It can either be,
mm.
it can have mild yeasty odor. Probably maybe she should smell it if she can perceive the smell. It can have a mild yeasty odor, or sometimes not. It doesn't really have odor. It's not like that one of bacterial vaginosis that has offensive and smell. And she said, okay, now is it
Mm.
like on every month? Or then I don't know if it's every month that she noticed it at a particular time just before the onset of her next or the onset of her menstruation. Then it's normal, especially that there are no other symptoms and all of that. But then if it's not like cyclical, then I will advise that she repeats the tests maybe somewhere else, because it could be a mild yeast infection. Those other symptoms may not set in immediately until later.
Okay, 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 okay. I think this will be the last question for tonight. Thank you so much, Dr. Lizzie. I mean, I'm
You're
about to say the
welcome.
last question, but this has been so detailed. I've learnt a lot. And I know the people also watching have learnt a lot. I mean, the comment section is filled with it's detailed. Thank you so much, and all of that. Thank you so much, Doctor. So, this will be our last question. Then, maybe you have any other
Yeah.
thing to add, advice, general well being, and all of that. Okay, so this is the last question. Are there health lifestyles that trigger lumps to grow in breasts? I noticed a benign lump in my left breast when I was 18. Noticed another in my right at 20. I finally took them out when I was 25. Less than a year later, I noticed another lump in my left breast. Scan says it's fibroadenoma. Is it okay if I don't take it out because I am tired? That's what the person is asking. Should I go over it again?
Yeah.
Okay. Are there lifestyles that trigger lumps to grow in breasts? I noticed a benign lump in my left breast when I was 18. Noticed another in my right at 20. I finally took them out when I was 25. Less than a year later, I noticed another lump in my left breast. The scan says it's fibroadenoma. Is it okay if I don't take it out because I am tired?
Okay. Lifestyles that triggers breast lump.
Mm,
Yeah, there are some lifestyles that can contribute to one having breast lump. And there are different, like poor diet is part of it. Exposing yourself to things that causes increase um fats, gaining weight. Poor diet can contribute to that. um Excessive intake of alcohol, smoking, all are these are factors that can actually contribute to one getting um this thing, a breast lump. But from her, she said fibroadenoma.
mm,
Okay. Um. Actually, from her, and in our own case, I don't really know what is making it to be this recurrent, because like it's
mm,
actually have been recurrent 18 at 20, at 25, and even after taking it out. So
mm.
I don't really know what could have been causing her to be recurrent, but I would love to actually make more inquiries on that and then get back to her through if that's okay.
That's very okay. That's very,
Um,
very okay.
okay.
Yes. Thank you so much,
Thank you.
Dr. Elizabeth. We appreciate this session. We've exhausted all of our questions, and I'm sure everyone who was part of this session has really been blessed and also impacted. Yes. So, everybody, I would love you to type in the comment section. Thank you so much, Dr. Lizzie. Please let's appreciate our guest speaker. You can put a clap emoji, you can put a love emoji, anything just to make her feel so special because she left all she was doing just to attend to you. Okay, for free, nobody paid anything to be here. So that's a whole lot of sacrifice. Thank you so much, Dr. Lizzie. God bless you, God enrich you, and we are so grateful. Thank you so much, ma'am. Okay,
Thank you so
we have
much for
come.
having me. I'm
You're,
grateful. Thank you everyone for turning out.
you're welcome. So we've come to the end of Let's Talk Women's Health, and this I will just tag this cohort 1 or episode 1. We'll have more of these, but this will now be very exclusive to the Her Marriage Journey community. Okay, so I'm going to brief you all later on the group how to join the community, so you have more of these, learn more, become better as a woman, as a child of God, as a wife to be, and all of that. Okay, so all of this you've learned today, don't throw it away. you know think about it. And also, if you have any more questions or you need personal mentorship with Dr. Lizzie, just let me know. Yes, just let me know. But this time to come with a fee because she is a specialized medical doctor. So you have to pay for her services. But don't worry, it's not something that's outrageous. So thank you so much, everybody. We've come to the end of tonight's talk show. You all have a beautiful evening. God bless you all. Good night.
Good night, Dr. Precious. Good night, everyone.
Okay.